session. Okay, this is a shortest subject, but this subject can give you out of the mark. Okay, so at least those who haven't studied this subject, at least study this PDF. Okay, fixed question, fixed hints, no change. Okay, थोड़ा इधर उधर का पढ़ लेना. Solve the question along with this PDF. Okay, from your favorite book, that is FMG solution. Okay, enough PDF plus question, enough. No need to go for so many extra data. Okay, all things will be written today. Okay, I will tell you what are the hints to solve the question. That's it. First, which is the largest organ in the body? The largest organ in the body is skin itself. Yes, how much? That is 4 kg, right? 4 kg. Now tell me, how many layers do we have in skin? How many layers we have in skin? Yes, it is epidermis, dermis, and hypodermis. Okay, in the epidermis we have how many layers? These are 5. Okay, these are 5. Do not confuse yourself. What are the layers of epidermis? These are stratum corneum, lucidum, granulosum, spinosum, and basal. Okay, we do need to remember the sequence. This can be remembered by the mnemonic. Base should generate lovely cells. Okay, base stand for basal, S stand for spinosum, generate stand for granulosum, lovely stand for lucidum, cell stand for corneum. ठीक है, आ गया समझ में? पता होना चाहिए. The idea should, anatomy का part है, थोड़ा सा आना तो चाहिए, right? Now tell me, how many cells we have in skin? Anyone? Okay. Which cell produces keratin? Which cell produces melanin? Which cell produces mechanoreceptor or receptor? Yes. And which cell is antigen presenting cell in the skin? Yes, that is Langerhans. Correct. Okay. Keratinocyte will produce keratin. Okay. Produces keratin, and it is present, remember this, all over epidermis. Okay. Then Langerhans cells are which shape? This is called as tennis racket shape. Tennis racket shape. These are antigen presenting cell. Right? कहाँ present होते हैं? It is present in stratum spinosum. Right? Melanocytes will produce melanin. Confusion यहाँ होता है. The melanocytes are present all over the epidermis or only in one layer, that is stratum basal. Confusion दोनों में होगा. ठीक है? Right? We have discussed this. Right? Which type of granules are present in Langerhans cells? The name of that is Baer-Beck's granules. Okay, Baer-Beck granules are present. Then there was a question: which keratin is defective in liver disorder? Okay, which keratin is defective in liver disorder? The keratin which has been asked is keratin number 8. Okay, liver cirrhosis. Okay, K8. If K8 is not in the option, then you should go for keratin number 18. Right, keratin number 18. Now I will ask some basic question, okay, about the lesions on skin. Now tell me, if there is a change in color less than 1 centimeter is called as what? If it is more than 1 centimeter, मैक्यूल का अपोजिट क्या है? मैक्यूल का बड़ा इज पैच, राइट? Okay, remember these are primary lesions. इसको हम क्या बोलते हैं? Primary lesions. Okay, if there is change in color less than 1 centimeter will be called as macule. Okay, but it goes more than 1 centimeter, that will be called as patch. Okay, that will be called as patch. Change in color, color किसी भी type का हो सकता है. Okay, a raised solid lesion less than 1 centimeter will be called as papule. Okay, more than 1 centimeter will be called as plaque, right? Plaque. Clear fluid vesicle, clear fluid lesion less than 1 centimeter will be called as vesicle. More than 1 centimeter will be called as bullas. Okay, more than 1 centimeter will be called as bullas. पस है, ये क्या था? Take a look over here, do not confuse yourself. This is water, this is pani, right? And take a look over here, it look like there is a pus, right? It look like there is a pus, so this will be called as pustule, right? And if there is a pus more than 1 centimeter, right, उसको हम बोलेंगे abscess. Then come extravasation of blood into the skin. अब छोटे छोटे एक्सट्रावेजेशन हुआ है, राइट? इंजरी हो गई, उसके बाद वहां पे डॉट डॉट्स दिख रहे रेड कलर के, राइट? रेड कलर के डॉट डॉट्स दिख रहे, दिस इज कॉल्ड एज पीटीके. जब आप मेडिको लीगल केस बनाओगे, दिस दैट टाइम वी विल राइट डाउन दिस, ओके, दैट छोटे छोटे डॉट्स है ग्रीन रेड कलर के इज कॉल्ड एज पीटीके, पिन हेड साइज, राइट? But there is extravasation of blood vessel more than 1 centimeter will be called as ecchymosis. Okay, basic hai, and if you are thinking question do not come from this, sorry, question do come from this question will not come out. Okay, छोटा सा दिख रहा है, that will be called as nodule, and if it becomes bigger more than 1 centimeter will be called as tumor. Okay, tumor. Now तुमने और भी लीजन्स देखे हैं, राइट? स्केल, क्रस्ट, राइट? हाइपरट्रॉफी, हाइपोट्रॉफी, scars, right? Mainly scars. Remember, these are not primary lesions. They can ask all of the following are primary lesions, except you have to rule out this. Okay, the problem is these names sounds like a primary lesions, but they are not, they are secondary lesions. They are secondary lesions. How do they look? What do you think? What will be this one? Take a look. This is called as scale. Scale हुआ है ना? This is scaling. This is scaling. Scaling है. बड़े बड़े से दिख रहे हैं पैचेस, right? This is called as scaling. This is called as crust formation. This is crust formation. Do not confuse yourself. Okay, disease बाद में पढ़ेंगे. First listen. What is this? Crust formation हुआ है, छोटे छोटे से crust बने, right? समझ आ गया इतना? What do you think? What is this? This is erosion. Erosion of skin is called as, इसको बोलते हैं erosion. ठीक है, ऊपर की स्किन उड़ गई, that is called as erosion. Deep cuts, this is called as fissure. This is called as fissure. ठीक है, this is called as fissure. Take a look. What is the difference between fissure and erosion? Erosion में बस superficial layer gone होती है, right? Take a look again. The superficial layer is gone, right? Fissure में क्या हो रहा है? There will be deep cut. There will be deep cut. What is this? This is called as scarring. This is called as scarring. Yes. What do you think? This is called as atrophy. Okay, atrophy हुई है. This is our lichenification. Okay, lichenification, correct. Okay, one-liners do come in derma. It is not all about just images. Okay, it is not just all about images. This is the most important table. If you are not able to remember, at least remember this. Increase in thickness of spot stratum spinosum is called as acanthosis. Okay, acanthosis. Separation of cell of stratum spinosum is called as acantholysis. Okay, क्या बोलेंगे हम इसे? Acantholysis. ठीक है, they sound similar. Okay, they sound similar, that's why. First one, take a look. The straight line on forehead, on hand, on legs. कैसा याद रखना है? Straight line on forehead, on hand, on leg is called as Langerhans line. क्या बोलेंगे हम इसे? Okay, yes, it is for better wound healing. It is for okay, if you will cut along this line, there will be better wound healing surgery के लिए, right? Then comes Take a look over here. Curved lines, and on this as well, है ना, ऐसे ऊपर जा रहा है नीचे आ रहा है, curved lines. Neck पे देखो, there is no straight line. Yes, it is called as Bolshevski's line. Why do we have Bolshevski's line? बताओ. It is for cell migration. Okay, cell migration होता है इससे, right? Now tell me, how many types of diagnostic technique we use to diagnose a disease? Commonly used techniques in derma. General है, right? This is KOH mount, diascopy, wood slam, Tanjac smear, patch test, and biopsy. Okay, these are the commonly used test. Okay, first one is KOH mount. KOH mount. Now tell me, what is the difference between KOH mount and fungal culture? We have used this in COVID era as well. Fungal culture takes time. It takes time around 1 month. Okay, but KOH mount is a screening test. Okay, we will scrape the skin. We will put that skin part into the KOH. Okay, उसके बाद उसको हम देखेंगे माइक्रोस्कोप के अंदर. That is called as KOH mount, right? Screening test एक तरह की. So what we, if you have studied mycology, there are two types of fungus. One will present with hyphae and one will present with pseudo hyphae, right? Pseudo hyphae. Which one is hyphae and which one is pseudo hyphae? Anyone from these images? Remember, hyphae का मतलब है branching. What I'm saying, hyphae means branching. Okay, pseudo hyphae means there is no continuation of branching. Take a look over here. This is separate, right? This is separate, not connected. This is separate. Yeah? So there is no continuous branching. Will be called as pseudo hyphae. And take a look over here. This is called as continuous branching, right? Continuity है उनमें दिख रहा है, right? So first one is pseudo hyphae. The second one is hyphae. Okay. Even in pseudo hyphae, if you can appreciate both the images, इसे क्या बोलते हैं? Take a look over here. It is called as, कुछ इस तरह का दिखता है, right? This is called as budding yeast. इसी को बोलते हैं. Okay, budding yeast. किसमें मिलेगा budding yeast? और pseudo hyphae is seen in candida, right? And branch septate hyphae is seen in tinea. ये दोनों तो पता है सबको, right? Dermatologically, if we are doing skin scraping, 10% of KOH will be used. For 40% we will use for nail, because nails are harder, right? Nails are harder. Everybody knows this, right? Favorite topic, that is pityriasis versicolor, right? Pityriasis versicolor. Which organism causes pityriasis versicolor? The name of that organism is Malassezia. Fur. Okay, fur. Yes. Now tell me which kind of pigmentation will be seen in this? Hypo, hyper. Image is in front of you. Hypo or hyper or both? It is hypo and this is hyper. So we can see both the type of pigmentation. Okay, कहाँ मिलेगा? That is in pityriasis versicolor. We will see. On microscopy, what you will see, है ना? ऐसे एक फैंसी डिश लेते हो आप लोग और उसके साथ खाते हो स्पगेटी प्लस मीट बॉल. This is our spaghetti on microscope with meatball. This is called as spaghetti and meatball appearance, correct? Spaghetti and meatball appearance. किसमें मिलेंगे? KOH mount. Now take a look over here. The क्या है ये पहले? This is called as diascopy. Diascopy means if there is a lesion, we will take glass slide. Okay, we will take glass slide and we will press it. On the pressing, if it becomes brown, it is called as apple jelly color. Okay, कहाँ यूज करेंगे? Lupus vulgaris. Whenever they are going to write down diascopy, remember most of the time answer is going to be lupus vulgaris. We will discuss the disease, just understand the basic first. Then comes Wood's lamp. What is Wood's lamp? Okay, in the dark room, we will take the patient, and by using this lamp, we will look at the lesion. Okay, उसमें specific color आ रहा है, that means that is the disease, right? Wood's lamp में पहले क्या है? The question is which wavelength is used? That is 365 nanometer, right? And the filter which is present is nickel oxide and barium silicate. You can remember by the mnemonic. Now only black shine, right? You love black, so it will shine. Now only black shine, right? Now tell me, coral red color on Wood's lamp is seen in which disease? Green color? Okay, coral red is seen in erythrasma. Green color is seen in tinea capitis. Vitiligo is white, right? So we will see white. Porphyria, red. Porphyria, red. What I am saying? Red. Remember, if they are going to say in porphyria on Wood's lamp, urine color is pink. Okay. Porphyria में कौन सा कलर मिलेगा? पिंक. बट क्या? यूरिन पे, ऑर्गन्स पे नहीं. ओके, मेक इट क्लियर. रेड क्या मिलेंगे? स्पेसिफिकली it is called as teeth. Teeth will be red. Okay, teeth will be red, right? If you want the mnemonic, I do have the mnemonic. eco, कैप्टन ग्रीन, राइट? मार्वल सीरीज देखते हो तुम? कैप्टन ग्रीन, राइट? vitiligo is white, so it will be more white, right? Porphyria, it name itself contain the mnemonic por. Po stand for porphyria, R stand for red, right? And PV, we do where? We do in gynecology department, right? PV is done in gynecology. Okay, what is PV? You know it, right? बताने की जरूरत नहीं है. मेलाज्मा, मेला, मेला होने से आदमी क्या होता है? काला, ब्लैक. ठीक है. This is called as coral grade red, seen in erythrasma. Green, seen in tinea capitis, right? We cannot appreciate the white patch over here, right? You know, white patch is there. So if you'll put wool lamp over here, it will be white. Melasma has black color. It will become more black. Porphyria, as I said, urine will be pink. Urine will be pink. ठीक है, समझ आ गया इतना? ट्रांजैक्समेयर, बस इसको पढ़ना है तुम्हें. Patch test, skin biopsy. Now comes, what is this first one? Why do we use this? The name is there actually, but when image comes in your exam, you won't be able to see the name. छोटी होती है, right? Cryogun will be used for cryotherapy, right? What do we have in cryogun? We have liquid nitrogen. Uses where we will use cryotherapy? Yes, in keloid and warts. In keloid and warts, right? We will use this. What is this? We will put the patient directly inside this box. We will close it. Yes, it is called as phototherapy, right? PUA, where we are going to use this one. Psoriasis, vitiligo, correct. And one more, atopic dermatitis. Okay, atopic dermatitis, where we will use this. Now we are going to discuss, this was all about general derma. Now we are going to discuss the diseases. The most important diseases in your exam is which one? The name of that disease is psoriasis. Right, psoriasis. Which gene is defective? It is HLA-CW6. Okay, psoriatic arthritis, other gene, but in psoriasis as whole, it is HLA-CW6. ठीक है, कंफ्यूजन मत होना. Then comes which interleukins are involved. Okay, first they will give you alpha, beta, gamma. Okay, alpha, beta, gamma, delta. Remember, it is TNF alpha, TNF alpha. And then which interleukins are involved? You can use this mnemonic 1 into 2 into 6 is equal to 12. Okay, 1 into 2 into 6 कितने होंगे? 12. So there are 4 interleukins which are mainly involved. Okay, what happens in psoriasis? Normally the cell cycle, right, जो बेसल से है ऊपर कॉर्नियम तक आ रही है, it takes around 4 days, right? It takes around 4 days. But what is happening over here? The cell turnaround will be faster, right? Sorry, 28 days लेती है. What will going to happen over? It will take around 4 days. 4 दिन में सोरियासिस में नीचे की तरफ से ऊपर सेल आ जाएंगे. ठीक है. So what you will see cell are dying faster. Cell are dying faster. Precipitating factors, very commonly used drugs, right? Very commonly used drug. And also stress, lithium. बहुत सारे होम्योपैथिक दवाई में लिथियम होता है हमारे यहाँ पे, राइट? आइब्यूप्रोफेन, दैट इज NSAID. Beta blockers are used by heart patient. And salicylate MI वालों को देते, right? So these are very commonly used drugs, can cause psoriasis. That's why this disease is asked so many times in your exam, right? You can remember the drug by the mnemonic Libas, and this has been asked, okay, right? Libas, at least remember this. Okay, at least remember this, has been asked and will be asked. Now, what are the clinical features of psoriasis? Anyone? You know it, I know this. What is going to happen over here? Scaling. Which type of scaling? It is silvery scaling, right? Patient will have, देख रहे हैं ना, सिल्वर जैसा, silvery scaling. Now, if I will take a glass slide, and try to scrape it, what is that sign is called as? Yes, it is called as Gratach sign. Okay, स्केल लिया और उसे स्क्रैप कर रहा हूँ सोरियासिस के लीजन को, दैट इज कॉल्ड एज ग्रेटाच साइन. डू नॉट कंफ्यूज योरसेल्फ, बेसिक भी पूछा जा चुका है. ओके, एंड ऑन स्क्रैपिंग, थोड़ा सा वर्ड चेंज हुआ. ऑन स्क्रैपिंग देयर आर, क्या बोलते हैं इसे, पिन पॉइंट ब्लीडिंग. ऑन स्क्रैपिंग देयर आर पिन पॉइंट ब्लीडिंग, दैट इज कॉल्ड एज ऑस्पिट साइन. स्क्रैपिंग क्या है? ग्रेटाच. On scraping there are pinpoint bleeding is called as ospit sign. ठीक है, do not confuse, this is very basic. ठीक है, this is very basic. Silvery white scale, right? Precipitating factors कुछ लिखेंगे, answer is psoriasis. But now comes the morphological variants of psoriasis. okay, ये तो basic था, है ना? सब कुछ पेपर में easy आ जाए तो कैसे होगा, right? okay, I used to remember this lesion personally. It look vulgar. कुछ समझ नहीं आ रहा है क्या है ये, right? Redness is there. There are silvery scales are present. Okay. So मैं इसको याद रखता था. It looks vulgar. And whenever they are going to give the morphological variant, that is vulgaris, psoriasis का जो vulgaris variant है, right? That they are going to give the image of elbows. They are going to give the image of elbow. Okay. It look vulgar. That's how I used to remember. Okay. And this is most common type. किसकी? Morphological variant की. Morphological variant की. Then comes other question. Okay. Patient had Pharyngitis. Patient had a pharyngitis in winter. In winter. Now there are some kind of lesion on his back. Okay, and image is given below. Okay, if you know Hindi, गट्टे बोलते हैं, हम गट्टे की सब्जी खाते हैं, right? These are the गट्टे, right? In गट्टे की सब्जी, what do we make? We make a round or cubical shaped, that gatta, right? Same over here, round or cubical shaped gatte on the back is called as guttate psoriasis. History, classical history will be given. They are not going to change. URTI or pharyngitis, upper respiratory tract infection, presented with winter, right? किसमें? Children. इसी को बोलते हैं रेन ड्रॉप लाइक रीजन. ऐसा लग रहा है the rain has dropped on his back. Okay? Rain drop like lesion, right? So this is your guttate psoriasis, and believe me, both has been asked. That too recently. That too recently. Basic अगर याद हो, patient was taking steroids for the some chronic disease. After some time, there is pus filled lesions. Pus filled lesion. Okay. The name of that is called as pustular psoriasis. Pustules है, right? History will be after taking. खत्म हो गया लेके, that is in English is called as withdrawal of systemic steroids, right? As soon as we will withdraw the steroids, this patient can have pus filled like lesions on the body, will be called as pustular psoriasis. Okay, pustular psoriasis. है ना? Silvery white scale all over the body. Silvery white scale all over the body is called as erythrodermic psoriasis. Erythrodermic psoriasis, right? This was morphological types of variants. First one, please, if you are not able to understand, take your time. ये important है psoriasis. First one is it looks vulgar on elbows. Vulgaris. Psoriatic type कौन सा? Vulgaris. Raindrop like lesion with infection of throat or nose will be called as guttate psoriasis. Pustules after withdrawal of steroids will be called as pustular psoriasis. Okay, silvery white scale all over the body will be called as erythrodermic psoriasis. ठीक है, erythrodermic psoriasis. Redness below the breast. Redness below the breast without silvery white scale is called as inverse psoriasis. Inverse psoriasis, right? Inverse psoriasis. Whiteness over nail is called as nail psoriasis, right? Nail psoriasis बोलेंगे इसे. Now we come to some one-liners which they are asking again and again. First one is nail changes in psoriasis. Now tell me which is the most common type of nail change in psoriasis. सामने लिखे वैसे, but most common type. And there is one more question, most specific nail change. Yes, remember this will confuse you. Pitting is the most common nail change. Okay, most common nail change. पिटिंग का मतलब क्या होता है? ऑफ्टन में बताता है, पिटिंग का मतलब होता है गड्ढे, राइट, होल्स. So take a look over here. This is called as pitting. गड्ढे बने, right? And most specific type nail change में, that is oil drop. It look like there are someone has dropped oil. Oil कैसा होता है? Brownish in color, right? So this is most specific oil drop. उसी को हम बोलते हैं ओनेकोलाइसिस. ओनेकोलाइसिस, right? चलो, then we come for psoriatic arthritis. Psoriatic arthritis. Which HL is associated with psoriatic arthritis? See, when you don't know the answer about arthritis, okay, which HL is associated, and you need to just give answer blindly. Answer is always going to stay. Okay, arthritis कोई भी हो, अगर आंसर नहीं पता है, mark this one. HLA B27. Over here also the answer is HLA B27, right? Which appearance is seen? That is called as pencil in a cup. Cup जैसा दिख रहा है, and this is our pencil. This is called as pencil in cup appearance. ठीक है, pencil in cup appearance. What is this? As soon as you will treat the psoriasis, as soon as you will treat the psoriasis, after some time, what will happen? Wherever we had a lesion, there will be formation of whitish line. There will be formation of whitish line. Is called as what? Warren of ring. Okay, कब होती है? जब we will treat the psoriasis, this lesion will be left out. ये आखिरी में बचेगा, ऐसे दिखेगा after treatment. Then we come to Koebner phenomena. Koebner phenomena. What is Koebner phenomena? It is written in front of you, but try to answer by yourself. Nothing. Just remember, a straight line is forming in the disease. Okay, straight line form कर रही है skin पे, is called as Koebner phenomena. ठीक है, this is Koebner phenomena. Now tell me causes of Koebner phenomena. What are the classical causes of Koebner phenomena? वन तो मैंने पढ़ा है, इसीलिए इसके साथ पढ़ा रहा हूँ. वन इज सोरियासिस, second one is vitiligo, and third one is it is lichen planus. These are all causes of Koebner phenomena. But remember, classical Koebner phenomenon is seen in only these three diseases: psoriasis, lichen planus, and vitiligo. Okay, pseudokoebner phenomena is seen in which diseases? That is molluscum contagiosum and warts. Okay, this all we will see Koebner phenomena, but rarely. Okay, do you want to know how the question will be tracked? Ultimately question solve करने, data थोड़ी collect करने आया हो. तो first question, Koebner phenomenon is seen in except, दिखता तो सब में है बट हमें एक्सेप्ट चूज करना है. What will be the answer? A, B, C, D. The answer is diarrhea disease over here because rarely, right? Lichen planus में तो कोएबनर phenomenon मिल रहा है ना. We are able, Koebner phenomenon is seen in except, right? So it is classically seen in psoriasis, lichen planus, and vitiligo. In which disease we are seeing rarely? So that is diarrhea disease, right? Now comes Koebner phenomenon is seen in all except. Now what will be the answer? The answer will be molluscum contagiosum. Reason being, it is pseudo. It is not true. Okay. Over here we have to rule out rare cause of Koebner phenomenon. But over here we have to rule out which disease is not going to cause a true Koebner phenomenon. That was the question. Okay. This is how the examiner is going to trick you in all the subject. Okay. And believe me, मेरे जैसा कोई बैठा है वहाँ पे. Lichen planus. Now, what I said in psoriasis, silvery color lesion. Silvery color lesion. Lichen planus, remember purple color lesion. Okay, purple color lesion. Whenever you are going to get question, purple color dikha, you will mark what? You will mark lichen planus. Hint chahiye. These are the hints. It is associated with what? It is associated with hepatitis C and B. Okay, it is associated with hepatitis C and B, right? और एक आता है question. Whenever you are going to get the question of lichen planus of mouth, okay, there is dental implant. There is dental implant. Okay, कौन सा वाला? इसी को बोलते हैं हम थोड़ी अच्छी सी इंग्लिश लैंग्वेज में डेंटल amalgam. That is mercury. Okay. This is the second hint. Yes, mercury. The mercury will cause lichen planus in your mouth, right? It will cause lichen planus in your mouth. P है, planus है, right? So all the features will be P, right? Purple color दिख रहा है, right? So all the features will be P. Pruritic, purple, polygonal, plain topped, papules and black. Okay, papules भी दिख रहे हैं और ये बड़ा सा plaque भी दिख रहा है. Okay, both will be present. Now dental amalgam है, right? Dental amalgam. जिसने यूज किया, whosoever have used will have a net like structure, will have a net like structure. इसी को हम बोलते हैं fish net appearance of oral mucosa. Okay, and this is your recent question. ठीक है, this is your recent question. क्या याद रखना है? Psoriasis, silvery white. Lichen planus, P stand for purple. So purple color lesion with fishnet pattern in the mouth will be lichen planus, right? What is this? Skin fold encroaching on the nail. Skin fold encroaching on the nail is called as pterygium. Yes, but which pterygium? Correct, it is pterygium. But which? You know hand? This is called a dorsal and this is called as ventral, right? Dorsal, ventral. So this is dorsal pterygium. Okay, dorsal pterygium is seen in lichen planus. Okay, lichen planus, right? ऊपर की तरफ है dorsal, नीचे की तरफ होता तो it is called as ventral pterygium. And tell me, where do we see this? This is seen in, yes, now it is seen in systemic psoriasis. It is seen in systemic psoriasis. ठीक है? Silvery white था psoriasis. Now we have something else. Now take a look over here. Redness, okay, redness है, and inside the redness we are able to see a whitish line. Okay, inside the redness we are able to see whitish line is called as pityriasis rosaceae. What do we call it? Pityriasis rosaceae. Okay, in psoriasis what do we had? We had silvery white scale all over the lesion, right? All over the lesion. मतलब यहाँ पर भी दिख रहा था सिल्वरी व्हाइट स्केल, राइट? ऐसे भी था पूरी तरह. But over here there is a single line which is inside the red lesion, will be called as pityriasis rosaceae. Okay, HHV7, right? HHV7. Okay, and this is how the pityriasis rosaceae will look. Herald patch, और इसी को हम बोलते हैं मदर पैच. Mother patch. Okay, mother patch will be surrounded with daughter patches. Okay, और एक appearance होता है. What is the appearance? Inverted fir tree, ulta tree. This is called as inverted fir tree appearance. ठीक है? This is seen in pityriasis rosaceae. Image आया तो कैसे पहचानना है? A big patch is surrounded by small patches. Okay, image can be real time, so पूरी image आए ऐसा कुछ नहीं है. ठीक है? Derma peoples can get the real time images easily, right? और आते भी है. What is this? A child presented with white patch on the face. Okay, but there is no loss of sensation on that white patch. What I'm saying, there is no loss of sensation on that white patch, will be called as pityriasis alba. क्या बोले हम इसे? pityriasis alba. ठीक है? Same image, what I'm saying, same image, exact image, with just adding loss of sensation on the patch. Okay, or there is no sensation or anesthesia of the patch. Answer is changed. Answer will be leprosy. ठीक है? एक image, question can be two. just by adding one word, no sensation and there is sensation. If there is sensation, that means the answer is pityriasis alba. ठीक है, दोनों पूछे जा चुके हैं and with exact same image 2 times. Pemphigus. One was purple color, one was silver color. Now pemphigus, remember, everything will look dirty. Okay, इससे गंदा कुछ हो ही नहीं सकता. Okay, इससे गंदा कुछ हो ही नहीं सकता. You are not able to understand anything. Okay, कि कौन सा डिसीज है. The answer is pemphigus. Okay, answer is pemphigus. Now comes the variant. The variant which is asked is pemphigus vulgaris. Again, whenever you are getting pemphigus as a disease, there are 2 variants. Okay, one is pemphigus foliaceus, one is pemphigus vulgaris. As soon as you will get the image of vulgaris, remember they will give you some pus filled lesion. Okay, they will give you some pus filled lesion, right? And one hint, as soon as we press this pus, as soon as we press this pus will spread ना. एक छोटा सा बुल्ला था, that बुल्ला is going to spread, right? उसी को बोलते हैं बुल्ला spread sign, right? Pus with nothing to understand, answer will be pemphigus. ठीक है, pemphigus, right? मैंने क्या बोला था, as soon as we will press this bulla, it will spread. That is called as bulla spread sign. But as soon as if you are going to press the bulla, there will be formation of one more bulla, will be called as Nikolsky sign. Okay, Nikolsky sign. Nikolsky sign, there is again catch. Okay, ये sign है, so it can be present in others as well. ठीक है, it can be present in others as well. ये समझ आ गया? This one you understood, right? On Tanzac smear, what you will see? You will see acantholytic cells. What is the meaning of acantholytic? Thickness. Thickness is increased. Okay, cell थी, उसकी thickness बढ़ गई. This is the cell. This is called as acantholytic cell. Okay. On microscopy, what you will see? You would have gone to the Christians' burial rituals, you would have seen, right? So what is going to happen? मुर्दे बनना. टॉम स्टोन का मतलब भी होता है टॉम के ऊपर जो स्टोन लगाया जाता है, मुर्दा जहाँ पे गाड़ा गया उसके ऊपर जो स्टोन लगाया जाता है, इट इज कॉल्ड एज टॉम स्टोन. You will see the same. Okay, this is called as row of tombstone appearance. Row of tombstone appearance. ठीक है, understood? On immunofluorescence, not directly looking. Over here we had fishnet appearance of oral mucosa. Okay, fishnet appearance of oral mucosa. But on immunofluorescence we have fishnet appearance, that is going to be seen in pemphigus. Okay, fishnet appearance is seen in pemphigus. Okay, एक वो था. Now comes a question with a hint. ठीक है, bullous pemphigoid. Bullous pemphigoid. What you are going to see? A bulla. नाम में ही a bulla with linear deposition. A bulla with a linear deposition is called as bullous pemphigoid. They have to write down this line. Okay, they have to write down this line. Then comes IgA, linear IgA deficiency. Linear का मतलब होता है line में, right? So remember this image, okay? Linear deposition of but IgA, not IgG, with a ring-like structure. Okay, a ring-like bulla. Over here, what was there? But यहाँ नहीं मिलेगा. ठीक है? Same question, which is going to be tricked. Immunofluorescence can look same, but the image will be different. Okay. Now, if I am not going to give you the image, what I can give you when I am going to ask about linear IgA disease, the hint is okay, one single alphabet will change the answer. Okay, will change the answer. Then comes dermatitis herpetiformis. What you are going to see? Lesions on hand, elbow, and knee. Elbow and knee. And if you will do immunofluorescence, what you will see? You will see granular lesions. You will see granular lesions. Okay? And there is one disease, bullous disease, which have negative immunofluorescence assay. That is epidermolysis bullosa. Okay, epidermolysis bullosa acquista. Okay, I know this is boring, but believe me, बस सोरियासिस ही नहीं है, बाकी भी डिसीज इंपॉर्टेंट है, वो भी आएंगी. And this is the most important table. Okay, lichen planus, pemphigus, bullous disorder, and psoriasis are the most important diseases of derma. Okay, dermatitis herpetiformis happens due to what? Due to gluten containing food, bro. Okay, what this patient can eat? They can eat only rice and maize. Okay, this patient cannot eat barley, rye, oats and wheat. गेहूं खा नहीं सकते. ठीक है, गेहूं खा नहीं सकते. This image looks similar with one disease, right? Castle necklace appearance. Castle necklace appearance, right? What happens? Niacin deficiency, right? Niacin deficiency. In niacin deficiency, what is going to happen? पेलाग्रा में क्या मिलता है? Just remember, if you're not able to understand, पेलाग्रा में the dermatitis, okay, dermatitis D में आता है, 4 Ds में dermatitis था. It is going to happen on sun exposed area. Sun exposed area. So dermatitis will be seen on hands, right? On hands, in the neck, on the face. But in diarrhea disease, it is opposite. ठीक है, अंदर मिलेगा. That is the one difference between diarrhea disease and pellagra. ठीक है, फोटोसेंसिटिविटी करें, उसमें सन एक्सपोज एरिया पे मिलेगा डर्मेटाइटिस. इन डायरिया डिसीज इट इज इनसाइड. Believe me, यही classical image है. So most of the time whenever they are going to ask about diarrhea disease, they are going to give this image. ठीक है, This is called as dyskeratosis, cough and ronds and grain appearance, right? Suprabasal acantholysis, okay? सेपरेशन ऑफ लेयर हुई यहाँ पे, ओके? माइक्रो में बताया होगा. Erysipelas. Remember, redness color, red patch on the mouth, red patch on the mouth will be seen in erysipelas. ठीक है? Port wine stain on the mouth is seen in this is red. Okay, there is one more port wine, right? Caused by strep pyogens. Caused by strep pyogens. Cellulitis. Remember, whenever you are going to get a case of cellulitis, they will write down one disease with this. The name of that disease is diabetes. Okay, diabetics patient are immunocompromised, so that's why there will be swelling. First, patient start with the swelling. Okay, after some time, from that side, patient can have pus also. Okay, pus also, right? And patient ultimately goes to sepsis, and patient will die. Reason: one organism which is present on our body will become more dangerous when patient is immunocompromised, and the organ name is staph. Okay, right? Yes, Sturge-Weber syndrome. We will see port wine stain. Okay, we will see port wine stain in Sturge-Weber syndrome. Redness कहाँ मिलेंगे? Erysipelas. ठीक है? See, if you are seeing a hair, a hair with a small pustule, what I'm saying, a hair with a small pustules, जहां जहां hair है वहीं पर pus भरा है, okay, will be called as folliculitis. Folliculitis. Okay, a hair with a swelling, यहाँ पर swelling हो गई, okay, will be called as furuncle. ठीक है, कहाँ है, क्या है यहाँ पे, swelling भी है. Over here, take a look, there is only one pustule, will be called as folliculitis. Follicle involve किया है, and that follicle is involving surrounding skin, will be called as furuncle. Okay, a lesion which is involving more than one hair follicle, more than one hair follicle will be called as what? Carbuncle. Difference has been asked. ठीक है, difference has been asked. ठीक है, examiner's favorite. Okay, a child with specifically वो क्या लिखते हैं, हनी क्रस्ट. हनी ब्राउन कलर का होता है, राइट? डार्किश ब्राउन. सो हनी crust appearance. Okay, honey crust appearance on the face will be called as impetigo. Will be called as impetigo. ठीक है, most common organism causing impetigo, and most common organism causing bullous impetigo, answer is this one. Over here, impetigo कौन कराता है? Staph है, staph. कंफ्यूजन है? Actually, there is controversy. Okay, there is controversy. Both are correct actually, but it is Streptococcus pyogenes. Okay, Paki, check your notes. I will not write down. Now take a look over here and take a look over here. Okay, a child with redness on his full body. Okay, what I'm saying? Redness on his full body will be called as Staphylococcus scalded fever. Okay, Staphylococcus scalded fever. Okay, child, a young adult, a young adult. What I'm saying? A young adult. रुको, देख रहे हो बाजू बड़ी young adult with full redness on the body will be called as 10. Okay, 10. यही इंट याद रखनी, पेपर में भी यही पकड़ना है. बोथ हैज बीन आस्क्ड. ठीक है, यंग अडल्ट दिया है रेडनेस है पूरे बॉडी पे विथ हेमोरेजेस, खून दिख रहा है, विल बी कॉल्ड एज 10. दैट्स इट. अ चाइल्ड, नाउ टेक अ लुक ओवर, इट इज अ फीवर, राइट? कहीं पे तुम्हें हेमरेज दिख रहा है? नो, दैट इज अनदर डिफरेंस. व्हाट इज दिस? A discoloration present in axilla. Okay, discoloration present in axilla. Due to what? Whenever you are getting a discoloration present in axilla, remember it is erythrasma. Erythrasma. ठीक है? Holes दिख रहे हैं? You are able to see holes, right? There are holes. This is called as pitted keratolysis. Pitted keratolysis. Okay. Discoloration of hairs present in axilla, है ना? समर में होता है, स्पेशली who lives in दिल्ली, गौतम नगर. No room for air inside the room. This is called as trichomycosis axillaris. Okay, trichomycosis axillaris. ठीक है, this has been asked. Okay, पढ़ लेना इसको. ठीक है. Now, whenever you are going to get a question of trichomycosis axillaris, remember the hint is this one. Yellow staining of cloth. Yellow staining of cloth. Answer is trichomycosis. खत्म. This can come even without image. ठीक है, even without image. ठीक है, टीबी के लीजन्स आते हैं, राइट? वी डू हैव टीबी लीजन्स. टेक अ लुक ओवर दिस चाइल्ड. Okay, there are lesions. They will give history of TB, of course. There are lesions present on the body. There are lesions present on the body. Will be called as cutaneous TB. This is called as cutaneous TB. TB is a chronic disease, right? It takes time to develop. Acutely कुछ नहीं होगा इसके अंदर, right? It takes time. Now, see, whenever you are seeing lesion on the neck, okay? Whenever you are seeing lesion on the neck in the exam hall, remember answer is TB. कौन सी TB होती? That is called as simple hint. neck में lesion है, 90% of the time examiner is going to ask about TB. The name of TB is scrophaloderma. What we will give? We will give ATT to this patient. ओके, एटीटी देना ही पड़ेगा, उसके बगैर नहीं होगा, राइट। एनाटोमिस्ट और पैथोलॉजिस्ट वर्किंग इन द मॉर्चरी, राइट। एनाटोमिस्ट किस पे काम करते हैं? दे वर्क ऑन डेड पीपल्स, राइट। नाउ he is having slowly developed scar on his hand, okay, slowly developed scar, क्या लिखेंगे उसमें? एनाटोमिस्ट और पैथोलॉजिस्ट, रीजन बीइंग they are exposed to TB of a dead people, so their hand will look like dead people, सड़ा हुआ लग रहा है. This is called as TB verrucosa cutis. This is called as TB verrucosa cutis. ठीक है, किस में मिलेगा? एनाटोमिस्ट और पैथोलॉजिस्ट working without bare, they are working with bare hands, okay. This is called as lupus vulgaris. Lupus vulgaris. Lupus vulgaris. Which medium is used to diagnose TB? Medium microbiology में पढ़ा होगा. And which screening test is done? This is called as LJ medium. LJ medium. Micro में पढ़ा होगा, right? LJ medium is used. This is called as Buruli ulcers. What is going to happen? Painless swelling, okay, or painless ulcer, right? Painless ulcer which is spreading, okay. ये भी नहीं याद रख पाओगे, just remember something black because it is seen in black peoples, okay. And there is a painless ulcer which is going, that is Buruli ulcer, okay. What do you think? What is this? Micro. How many of you have, in the movies you would have seen a volcano, right? A volcano which is coming out, है ना? Volcano which is coming out from the big mountain of volcano, right? Volcano sign is seen in leishmaniasis, that too in cutaneous leishmaniasis. Take a look. Okay, if you will see volcano from the top, if you will see volcano from the top, ये पहाड़ है, and from here the lava is going to come out, the lava is going to come out. This is called as volcano sign seen in leishmaniasis. Take a look over here also. Redness, top पे से हम volcano का पहाड़ देख रहे हैं, and there is volcano which is going to come out, lava, red color lava is going to come out, and this is called as cutaneous leishmaniasis. Sign का नाम क्या है? Volcano sign. Again, one hint. Patient is from Delhi, now presenting with such kind of lesion will be called as cutaneous leishmaniasis. इंडिया का पेपर है, सो इंडिया का हिंट है, दैट इज दिल्ली बॉय, ओके. Organism, this is the question from micro, PSM and derma. Everything is interconnected. The organ name is phlebotomous, right? Phlebotomous. A dentist which is working in his hospital now presented with papules on the fingers, okay, and there is pain. What do you think? I have given you the hint. Dentist presented with papules or multiple papules on the fingertip. The answer is herpetic whitlow. The answer is herpetic whitlow. Reason being, patient is having herpes, right? And dentist is putting fingers in the mouth of the patient. So this is called as herpetic whitlow. Micro again. Okay. Okay. Image बच्चे के ऐसी आएंगी. There are lesions on the near to oral cavity is called as oral herpes. और इसी को बोलते हैं हम, what do we call it? Herpes labialis, है ना? Herpes labialis, right? Just look like someone has hit the target. This is called as target lesions. Which virus causes herpetic whitlow, herpes labialis, and erythema multiforme? This is called as HHV1. Human herpes virus 1. Okay, HHV1. Take a look. There is redness which is present on the down skin पे क्या है? Redness है. There is redness and one lesion. Okay, लाल कलर का रेडनेस है, उसके ऊपर एक पानी जैसा लीजन बना हुआ है. ओके, पानी जैसा लीजन बना हुआ है. रेडनेस ऑन द डाउन एंड देयर इज water. This is called as dew drop on rose petal. Dew drop on rose petal is seen in which virus? Yes, it is seen in, इसलिए तो पूछा जाता है. Easiest question, still people mark it wrong. This is due to varicella zoster virus. Okay, varicella zoster virus. We have discussed this in ophtha, in ENT as well. This is herpes zoster ophthalmicus, right? If it is going to involve the ear कान इन्वॉल्व हो गया, that is called as herpes zoster orticus. This is called as herpes zoster orticus. फिशनेट पैटर्न किस में मिल रहा था? लाइकन प्लानस में, राइट? Now there are spots. There are spots on the oral mucosa. There are spots on the oral mucosa. It's called as Koplik spot, and it is seen in what? Yes, correct. And this is your recently asked question. Seen in what? Seen in measles. Seen in measles, right? Now, how to differentiate chickenpox and measles? चिकन पॉक्स में क्या मिल रहा था हमें? Now, measles and chickenpox, the differentiation is it will start from chest, it will start from head. Okay, I will be involved in measles. ठीक है? ना? When you will hit your baby, his or her cheek will become red, right? This is called as slapped cheek appearance, and it is seen in गुस्से से लाल हो जाती है, right? Slapped cheek appearance is seen in parvovirus B19, right? Parvovirus is which disease? First, second, third, fourth, fifth, sixth. Anyone? Just calculate the alphabet. This is fifth disease. This is fifth disease. ठीक है, पार्वो में 5 है. Yes, right. A lesion with central umbilication. Okay, एक lesion होगा and there will be in the center umbilication, है ना? ऐसा लगेगा कि umbilical cord बाहर आ रहा है, right? Lesion with central umbilication will be seen. Take a look over here. Lesion with central umbilication will be seen in molluscum contagiosum. ठीक है, molluscum contagiosum. A child presented with lesion on mouth, foot, okay, and hand, right? Again, do not confuse. Over here, we are going to see lesions only on mouth. Okay, mouth पे मिल रहा है, herpes labialis में, right? Chicken pox, measles all over the body, right? Chicken pox and measles में all over the body मिलेगा. In hand, foot and mouth disease में बस the name itself speak. नाम ही लिखा है, hand, foot and mouth disease. ठीक है, it is caused by what? Micro Coxsackie disease. ठीक है, Coxsackie disease, right? Even they can give you this image, it has came up and they will write down the description of it कि उनके उसके हाथ और पैर पे भी लीजन्स है. The answer is Coxsackie, right? This is called as herpangina. This is called as herpangina. ठीक है. Now we come, that was all about viruses that you need to know. Now we come to fungal infections, and this is important. Okay, this is important. Now, which type of fungal infection will involve which part of the body? Okay, trichophyton. Tricho means 3, right? Tri means 3, right? So it will involve 3 all. Okay. Then comes, remember, N goes with N. Epidermophyton will involve nail, but they will not involve hair. Okay. N will go with N. बचा कौन सा? माइक्रोस्पोरम, ऑपोजिट ऑफ इपिडर्मोफाइटोन. इट विल नॉट इन्वॉल्व नेल. ठीक है, माइक्रो में बताऊंगा. देन वी कम धोबी which is working on river. Dhobi which is working on the river now presented with itching on the body or itching in the groin area. Itching in the groin area. ठीक है, दिस इज कॉल्ड एज धोबी इच. ठीक है, धोबी इच. कॉर्पोरा का मतलब ही होता है बॉडी. ठीक है, कॉर्पोरा. सो whenever you are getting a question with, okay, and when you don't know the answer, okay, when you don't know the answer, remember the fungal infection to mark the answer is tinea cruris. Okay, tinea cruris और tinea corporis, यही मार्क करके आना है. ठीक है, जब समझ में नहीं फंगल इन्फेक्शन, तो इन्फेक्शन इज टीनिया क्रूरिस और कॉर्पोरिस. ठीक है. देन सी दिस, a lesion with central clearing. Okay, a lesion with central clearing. Clear है. Take a look over here also. Lesion is clear. Okay, this is the classical presentation. ठीक है, classical presentation. पेडिस में क्या होगा? Web spaces will be involved. Right, web spaces will be involved. Take a look over here. Right, the question which is classically asked is tinea cruris or corporis. Now what I said, when you don't know the answer is tinea cruris, right? Now remember, candida bhi hai, but whenever groin infection in the Canada, not in Canada, in the candida, remember, you will see lesion, you will see lesion, you will see lesion, but remember, you will see dots at the end of main lesion. You will see this when there is an infection of candida in your groin area. ठीक है, उसी को आप बोलेंगे अर्थ विद सैटेलाइट. सो सैटेलाइट लीजन्स विल बी सीन. कॉर्पोरिस में मिल रहा है, क्रूरिस में मिल रहा है, नो. राइट, यू आर नॉट एबल टू सी दिस. दिस इज द डिफरेंस. कैंडिडा मार्क करके नहीं आएगा कोई, याद रखना. Do not mark it, please. This is your recent question. Okay. In February, a gardener was working in the garden. Okay. A gardener was working in the gardener, and there is, after some days, he presented with such kind of lesion, such kind of lesions. What is the diagnosis? Gardener दिया है, right? There is lesions which is going to involve a single lymphatic duct. Okay, single lymphatic duct. दूसरी हिस्ट्री क्या होंगी? के कपल वेंट इनटू गार्डन and he or she had a thorn prick. Thorn prick. Okay, thorn prick. The disease name is what? Recent question है इस बार का. Sporothrix Shanke. Okay, lesion will be involving one lymphatic duct. So lesion कैसा होगा? एक लाइन से चल रहा होगा. Okay, it will go in one line. ठीक है. The name is Sporothrix Shanke. What is the name of this body which we will see on microscopy? Yes, asteroid body. Okay, this is called as asteroid body. Okay, micro में भी आ सकता है, derma में भी आ सकता है. Even this can be asked from the PSM site. Now take a look at the lesion and you can see there are so many different types of color. है ना? थोड़ा काला है, थोड़ा faded black है, थोड़ा सा white है. So there are different types of color. Even take look over here. White है, red है, थोड़ा सा black दिख रहा है कहीं पर. There are different types of color. Color को क्या बोलते हैं? Chroma. It is called as chroma. So this is chromo. और क्या हुआ यहाँ पे? different टाइप के कलर का ब्लास्ट. क्लोरोब्लास्टोमा. समझे? सॉरी स्पेलिंग गलत हो गई. कलर को क्या बोलते हैं हम? क्लोरो. राइट, क्लोरोब्लास्टोमा. Blast of colors in the lesion will be called as chloroblastoma. Right? Again, history will be same. Trauma by vegetative material. Trauma by vegetative material. Vegetative का मतलब क्या होता है? Sharp, right? What is this then? This is also sharp, right? This is also sharp. So whenever you are getting question, remember Sporothrixanki and chloroblastoma or chromoblastoma. Lesions will be different. It is going to involve one lymphatic duct. Okay, Sporothrixanki, one lymphatic duct. Chromoblastoma or chloroblastoma will involve a part. पूरा part involve हो जाएगा वहां पे जहां पे prick हुआ है, right? So be careful with both the questions, right? Be careful with the both question. Yes. इसको क्या बोलते हैं हम? You have seen 1 rupees coin, right? 1 rupees coin दिख रहा है, right? So what we have over here, brown color 1 rupees coin, that is called as copper penny appearance. Right? Now, ये तो तुम पहचान लोगे, but take a look over here. A whole slide is violet and there is little bit of brownish color. Okay, this is also copper penny appearance. Okay, drug of choice, itraconazole. Itraconazole. ठीक है. What is this? This is your foot, Madura foot, right? Causes क्या होते हैं? Actinomycetoma and eumycetoma, right? Actinomycetoma and eumycetoma. How to differentiate actinomycetoma from eumycetoma? Anyone? Remember, in actinomycetoma, there will be lesions without pus discharge. What I'm saying? Lesions without pus discharge. देखो कहीं से pus निकल रहा है? No, right? This is called as, but remember in eumycetoma, there will be pus discharge or pus दिखेगा, right? This is called as eumycetoma. Eumycetoma. ठीक है? Patient presented with itching all over the body. Specifically, this itching increases in the night. This itching increases in the night. What is the diagnosis? बस बताओ. नेक्स्ट टॉपिक की बात कर रहे हैं. यस, आंसर इज स्केबीज. ओके, आंसर इज स्केबीज. ओके, आंसर क्या है इसका? Hint is itching, increased in itching in night. This is the hint. Okay, कहां पर होता है? We will follow this itching specifically happens. Sorry, सर्कल ऑफ हेब्रा बोलते हैं इसे. दिस इज कॉल्ड एज सर्कल ऑफ हेब्रा. करेक्ट. सर्कल ऑफ हेब्रा. क्लासिकली यहाँ पर इचिंग होती है, बट बिलीव मी ऑल ऑफ अस वॉशेस हैंड. ओके, क्लासिकली यहाँ पर होता है स्टार्ट, बट ऑल ऑफ अस वॉशेस हैंड. सो क्वेश्चन में वो हैंड का नहीं लिखेगा. ठीक है, हैंड हम वॉश करते हैं तो यहाँ पर माइट्स नहीं होंगे, स्केबीज माइट्स नहीं होंगे. राइट. हाउ टू आइडेंटिफाई स्केबीज माइट? रिमेंबर 5 5 1 2 3 4 5. Okay, this is scabies mite. Okay, this is scabies mite. Right. Now there are different types of scabies. Right. One which is going to be asked, normal scabies, जो तुमने पढ़ा है. Right. There is one scabies which is seen in the beggars. Which is seen in the beggars. किसमें? भिखारियों में. Right. Or those people who don't have homes. Right. This is very common in Europe. People don't have home, है ना, होमलेस. हमारे इधर इन्हीं को भिखारी बोला जाता है. राइट. बेगर्स हु लिव्स विदाउट होम. राइट. These people will come with most severe form of scabies. Okay, it look like there is a mountain of scabies on their hands, on their palms, on their body, and there will be so much of itching. Actually, these patients are immunocompromised. Okay, these people are immunocompromised, or these peoples are infected with HIV. So what they are going to write down whenever they are going to ask? Norwegian scabies, beggars, or people who are living on the footpaths, right? Or patient is HIV patient. This patient will have most severe form of scabies. The name of that scabies is Norwegian scabies. Right. क्या देते हैं हम? Topically permethrin, right? Correct. Ivermectin. But now these drugs are contraindicated in pregnancy. We cannot give this. So which drug should be given in pregnancy? Pregnancy में scabies हो गया. What we will give? The name is precipitated sulfur. We will give precipitated sulfur. Okay. बचपन में सबको हुआ, right? itching in the head and trying to catch this. This is called as pediculosis jue. Okay, pediculosis. Pediculosis. How to identify pediculosis mite? 6 legs. 6 legs. Okay, right? Now in that also they will ask male and female. What do you think? How to identify male and female? मेल का बाहर होता है, लटका हुआ. फीमेल का अंदर होता है. इन ह्यूमंस सेम गोज ओवर देयर. Same thing, right? Patient went barefooted on the seaside. Okay, and there is a lesion, a linear lesion. Okay, क्या बोलते हैं इसको? Patient went barefoot on seaside. This is called as hookworm. हिस्ट्री क्या मिलेगी? Barefoot on seaside, right? Right? हुकवर्म कैसे दिखता है? How to identify hookworm? नाम क्या है? Hook. So there should be a hook, right? Yellow hook. Okay. Hookworm will look like a hook. ठीक. Definitive host कौन है? Animals. Definitive host are animal. Man is a it is a incidental host. Okay, incidental host, right? क्या बोलते हैं इसको हम? क्यूटेनियस लार्वा माइग्रांस. क्यूटेनियस लार्वा माइग्रांस. हिस्ट्री क्या मिलेगी? बेयरफुट. This is called as, take a look over here. There is worm in the eye. There is worm in the eye. Okay, with swelling. This is called as collabar swelling with worm inside the eye. The name is, गाना है एक, बचपन में सुना होगा तो पता नहीं, मिस्टर लोआ लोआ. Okay, मिस्टर लोआ लोआ तेरे आंखों का जादू. Right? The आंखों का जादू is this one. There will be a worm inside. ठीक है? सुन लेना गाना मिस्टर लोआ लोआ. ठीक है? The treatment is डाइथाइल कार्बेमाज़ेपिन. डाइथाइल कार्बेमाज़ेपिन. ठीक है? Vector for लोआ लोआ disease is डियर फ्लाई. डियर फ्लाई. डर्मा के साथ हम माइक्रो भी रिवाइज कर रहे हैं. Okay, but now there is only swelling on the eye with bite of an insect. Okay, collabar swelling, what was happening? There was swelling on the downer side. What has happened over here? There is swelling on the eyelid as well. This is called as रोमाना साइन. ये भी एक गाना है, हे रोमाना तेरी आंखें. Okay, जॉन अब्राहम का. रोमाना साइन is seen in Chagas disease. Cause क्या है? Yes, it is red wood bug. Okay, red wood bug is actually not red. The borders are red. Okay, confused नहीं होना है. This is the insect. Image भी पूछे जा चुके हैं. Now we come to a fixed topic. Now we come to fixed topics, sure short question, genital ulcers. And believe me, if you know this two table, 90% of the time your answer will be correct. Read this and remember, ulcers will be painful in herpes and chancroid, painless ulcer, syphilis, donovenosis, and LGV. Then comes lymphadenopathy, will be seen in syphilis, right? कौन सी lymphadenopathy होंगी? Painless, herpes painful, LGV painful, chancroid painful. So in short, remember this: syphilis always start as a painless lymphadenopathy. ब्यूबो और सुडोब्यूबो इज सीन इन डोनोवेनोसिस. ये टेबल अच्छे से पढ़ना है, क्वेश्चन विल बी इजी. ओके, नाउ कम्स herpes genitalis. If you are remembered, now again take a look. अल्सर कैसे होंगे? पेनफुल. सो क्वेश्चन में क्या आएगा? मल्टीपल पेनफुल ग्रूव वेसिकल और इरोजन present on the genitals with lymphadenopathy कैसी हो रही है? पेनफुल, राइट? सो आंसर क्या है उसका? द आंसर इज herpes genitalis. Okay, herpes genitalis. Incubation period 2 to 12. What is the treatment? Acyclovir. ठीक है. herpes genitalis 2 वाला करवाता है ना, राइट? herpes simplex 2 ही तो करवाता है genitalis. upper body 1, lower body 2. okay, क्या हिंट पकड़ना है? पेनफुल vesicles with painful lymphadenopathy. Answer is herpes genitalis. What is this? Painless, right? Painless, ऊपर लिखा हुआ था painless, right? Chancre, a single lesion present on the genital is called as chancre. क्या है यहाँ पर? Painless है. Answer will be syphilis, right? Answer will be syphilis. This is called as condyloma. Which condyloma is caused by syphilis? It is seen in gays, of course, right? It is condyloma lata. Condyloma acuminata is seen in which disease? Yes, correct. Then we come to the tertiary syphilis. What we are going to see, it can involve anything, okay? It can involve anything. We will see a Hutchinson triad. Hutchinson teeth, deafness, and interstitial keratitis. Interstitial keratitis, eye involvement होगी. Will be seen in late syphilis. Okay, we will see in late syphilis. This is called as Hutchinson teeth. Okay, this is called as Hutchinson teeth. ठीक है. Perforation of hard palate will be seen in which syphilis? That is congenital. It is seen in congenital syphilis. Then we come to chancroid. शंकरॉइड। सिफिलिस में क्या था? One single lesion, but it was painless. Now over here also, take a look. It looks single lesion. It looks single lesion, but the hint which you have to catch is, सबको लगेगा मैंने आंसर करेक्ट किया है, that is syphilis, but sorry, the answer was hemophilus ducrey. रीजन एग्जामिनर ने उसमें लिखा था पेनफुल अल्सर। क्या लिखा था? पेनफुल अल्सर। ठीक है, that same image, okay, that same image with one word change, answer will change. The answer is hemophilus ducrey. क्या कैच करना है? This one. Then वो भी नहीं लिखा है, if it is not written, remember undermined मतलब अंदर के तरफ, undermined मतलब inside, अंदर की तरफ आ रहा है ऐसे लग रहा है। शंकरॉइड what was there? बड़ा सा लग रहा था, so it was not undermined. undermined मतलब नीचे जा रहा है। ठीक है, अंदर। what do we get? School of fish appearance. School of fish appearance उसका मतलब क्या हो? If you have seen fishes, they go in line, है ना? मूवी में देखा है, एक लाइन में ऐसे चलते हैं वो, that is called as school of fishes. लाइन में चल रहा है, this is called as school of fishes seen in Shankaroid. Donovinasis. Donovinasis, just remember dark, है ना? काला, if you are seeing kala, then the answer is donovinosis. क्या काला? ये काला। बात खत्म, ज्यादा नहीं पढ़ना है। ठीक है, ओके। हिंट्स है, वो जो दो टेबल है वो हिंट्स है। स्टिल रिमेम्बर डोनोविनोसिस काला, इट इज सीन इन अफ्रीकन पीपल्स, दैट्स इट। काला दिख रहा है, आंसर इज दिस वन, राइट? नाउ this donovinosis, if the organism is together, okay, if the organism is together will be called as donovinon body. but ये पूछती नहीं है पेपर में, what they ask how they look. This is called as safety pin appearance. This is called as safety pin appearance. ठीक है, LGV, LGV में याद रखना है, lesion with lymphadenopathy, tender lymphadenopathy. ठीक है, किस में मिलेंगी? इट इज सीन इन LGV. Okay, I will not teach this. Reason is vaginitis है, you have studied this in ops and gynec. Still I have made it for you. The table is in front of you, the most important topic. Okay, we will go faster because it's already 2.5 hours. 2 hours, not 2.5 hours. Leprosy. They will ask you this time, what is the cardinal sign or triad of leprosy? What should we have in leprosy? We should have hypopigmented skin lesion, right? Enlarged peripheral nerve and AB positive, acid fast bacilli positive. This is the cardinal sign of leprosy, and this was your recent question. Okay, recent question. Then there are some one-liners which they will ask. Okay, sensation for which type of temperature will go first? The answer is cold temperature. The answer is cold temperature. Okay, cold temperature. Which nerve most commonly involved? The answer is ulnar nerve. Okay, ulnar nerve. Most common cranial nerve which is involved is facial. Facial. Okay, and this is the types of leprosy. TT, tuberculoid, tuberculoid. BT, borderline tuberculoid. BB, borderline, borderline. BL, borderline leprosy. Lepromatous. Lepromatous leprosy. LL. Okay, now Remember this, in TT, tuberculosis, complete anesthesia will be seen. Okay, borderline TB, I will show you the images. Remember, Earth surrounded by satellite lesions. Okay, Earth surrounded by satellite lesion, right? Annular punched out lesion, a single lesion. Okay, BL नहीं पूछे जाएंगी. Still, I will show you the image. Okay, first is TT, tuberculosis. Remember, a lesion, a lesion which has well defined border. Okay, एक गड्ढा है, उसकी बॉर्डर सही है, बट इट इज डिप्रेस्ड, अंदर से नीचे की तरफ धस चुका है. ओके, टेक अ लुक ओवर हियर. ठीक से देखो, बॉर्डर है, लग नहीं रहा है थोड़ा अंदर चला गया. ओके, दिस इज कॉल्ड एज tuberculosis. ओके, whenever you are going to get question on TT, remember they will give you a lesion, white lesion with a nerve involvement. A nerve involvement. What is going to happen over here? There will be thickness of nerve. Thickness of nerve with a single lesion will be called as TT. ठीक है, TT. Then we come to BT. Yes, BT. What I said? Satellite lesion. Satellite lesion का मतलब क्या होगा? Earth surrounded by satellites. Earth surrounded by satellite. This is seen in BT. This is seen in BT. Okay. Okay, आगे समझ में? Annular lesion. Annular lesion. गोल. गोल लीजन. एनुलर का मतलब होता है सर्कल. ठीक है, एनुलर लीजन, राइट. एंड बिजार जियोग्राफी, उसका मतलब क्या होता है? देयर इज नो कनेक्शन, कोई कनेक्शन नहीं है ना. दैट इज कॉल्ड एज बिजार जियोग्राफी. बट रिमेंबर, बीबी गोल लीजन. बीबी गोल लीजन, है ना. बीबी के हाथ के खाना खा के गोल बनता है आदमी, मोटा होता है, राइट. सो गोल लीजन. बीटी में क्या था? अ लीजन विथ सैटेलाइट्स. ओके, ओवर हियर a depressed lesion with nerve thickening. Okay, depressed lesion with nerve thickening. Okay, then we come to LL. LL में क्या होगा? There will be multiple hypopigmented patches. Multiple hypopigmented patches without loss of sensation. Okay, without loss of sensation. But remember, there will be no single patch. It will be all over the body. ठीक है, it will be all over the body. That is called as lepromine. ठीक है. लियोनाइन फेसेस, जो अपने आप को शेर बोलता है, लायन बोलता है, he should have first leprosy. okay, तभी जाके तुम शेर जैसे तुम्हारे यहाँ पे स्ट्राइप्स आएंगे. That is called as leonine passes, and this is a real time image. Okay, real time image. There are better image if you want to look. Take a look from the. Okay, there are two types of reaction which we see in leprosy. One is type 1 leprosy reaction. Type 1. How to remember which hypersensitivity? Just remember the alphabet 5. Okay, 1 plus 4 is equal to 5, right? So hypersensitivity is type 4. Okay, type 4 1 में. In type 2, which hypersensitivity will be seen? 2 plus 3 is equal to 5. So टाइप 3 hypersensitivity. ठीक है, टाइप 3 hypersensitivity and this is the way to remember. चलो आगे बढ़े. Read this, it is easy. This is called as port wine stain. This is called as port wine stain, right? Port wine stain will be seen in Sturge-Weber syndrome. Will be seen in Sturge-Weber syndrome. ठीक है? Okay. You should know this. Coinant tumors, angiofibroma on the nail hairs will be seen in tuberculosis, chagrin patch. Okay. ऐसा लगेगा किसी ने शॉल ओढ़ी है अपने पूरे बदन पे. That is called as chagrin patch. Will be seen in tuberous sclerosis, right? And angiofibroma. Take a look. The multiple fibromas on the face will be seen in tuberous sclerosis only. Okay. A mechanic working in his store now presented with lesions on the joints area of hand. What I am saying, lesions on the joints area of hand is called as what? Mechanics hand, right? पूछा जा चुका है. This is called as mechanics hand. किसमें मिलेगा? It is seen in mechanics, है ना? वो भोगते रहते हैं, right? They used to do some hard work, so they will have lesions on the joints पे मिलेंगे, joints पे. ठीक है, इसको भी पढ़ लो. We will finish it faster. ठीक है. Carpal tunnel sign is seen in DLE. ठीक है, diffuse DLE. Okay, we will see it in DLE. Okay, थोड़ा सा nails का पढ़ते हैं, then we will finish the class. Okay, actually this is 400 slide class. I have tried to cover it in 160 slides. ठीक है, थोड़ा fast चलूंगा मैं. See, half is red, half is white. Half is red, half is white. It is seen in CRF, half and half nail बोलते हैं इसको. It is seen in chronic rail failure. Okay, now terry nail. Terry nail कैसे दिखेंगे? It is, see, half nail था, red था, white था. Over here थोड़ा सा ही कलर चेंज हुआ है. Okay, this is called as terry nail seen in liver failure. Liver failure में ये nail मिलेगा. Now there is a line passing in the middle. There is a line passing in the middle is called as Mees line. One line होंगी will be seen in arsenic. Okay, arsenic. Now two white line passing. यहाँ पर एक पास हो रही है, right? Over here there are two white line which is passing, is called as Meurk's line seen in hypoalbuminemia. Color changes. How do color change? Green color is seen in Pseudomonas infection. Okay, yellow will be seen in tetracycline. ड्रग खाने के बाद भी ड्रग रिएक्शन हो सकती है, राइट? एंटी मलेरिया ड्रग ब्लू. You can remember by the mnemonic grape. Okay, right? Yet tetracycline, right? BA BC, no, white albuminemia का ही मतलब होता है white, right? Grape, yet BA BC. Okay, एक बार याद कर लो, बाद में भूल जाओ. This has one liner से ये क्वेश्चंस ये आ चुके हैं. ठीक है, के एलोपेशिया एरियाटा, एलोपेशिया एरियाटा, इसमें क्या होगा, देयर विल बी एक्सक्लेमेशन साइन, डैमेज ऑफ एयर से लगेगा, देर इज एयर टूट के थोड़ा साइड में गया है, दैट इज सीन इन एलोपेशिया एरियाटा। ठीक है, एलोपेशिया एरियाटा। सेंट्रल बाल्डिंग इज कॉल्ड एज सीसाफियो, सीसाफियो। ओके, बाल्डिंग नीचे की तरफ है, इज कॉल्ड एज उफियासिस, उफियासिस। ठीक है, एलोपेशिया टोटालिस मींस ओनली ऑल स्काल्प हेयर विल गो, एलोपेशिया यूनिवर्सालिस मींस वहां पर एक भी बाल नहीं बचेगा, फ्रॉम द हेड का बाल टू द डाउन का बाल। ओके, ऑल बाल्स विल बी गॉन, दैट इज कॉल्ड एज यूनिवर्सालिस। सिंपल है, मुझे भी पता है, तुम्हें लग रहा होगा कि ये क्या पढ़ा रहा है, ये क्वेश्चन वहां पे जाके गलत होते हैं। ठीक है, बहुत सारे टॉपिक से पढ़ाने के लिए, लेकिन पढ़ा क्यों रहा हो ये क्वेश्चंस गलत नहीं होने चाहिए वहां पे। सिंपल डेफिनेशन है, बट इट कैन कंफ्यूज व्हेन क्वेश्चन इज इन फ्रंट ऑफ यू। ये एलोपेशिया टोटालिस, और इसका मतलब तो टोटल बाल गए, फिर तुम सोचोगे पूरे बॉडी के बाल गए, बट नहीं, आंसर क्या था, स्काल पेयर था बस, हो गया गलत, राइट, यही होता है। सो प्लीज रीड दिस सिंपलेस्ट लाइन केयरफुली, हार्ड तो हर कोई पढ़ता है। ठीक है, ओके, वी यूज, स्पेशली गर्ल्स यूज टू टाई देयर हेयर्स, राइट, बाल में कंघी भी जोर से करते, फास्टली फास्टली, सो व्हाट कैन हैपन, द एलोपेशिया विल बी प्रेजेंट ऑन द बॉर्डर लाइंस, बाल खींच खींच के वहां के बाल निकल गए, दैट इज कॉल्ड एज ट्रैक्शन एलोपेशिया। ओके, ट्रैक्शन एलोपेशिया, दिस इज नॉट ट्राइकोटिलोमेनिया। ओके, दिस इज ड्यू टू बाल खींचने से आगे के बाल टूट रहे, दैट इज कॉल्ड ट्रैक्शन एलोपेशिया। ओके, ट्राइकोटिलोमेनिया, व्हाट इज गोइंग टू हैपन, we are going to take out the hairs from where whichever side we want to take, so there will be holes, कहीं पर भी मिलेंगे। okay, okay, there will be holes, yes। The circular lesions present in hair will be called as moth-eaten alopecia, seen in syphilis। acne, acne, simplest topic, question has been asked। okay, acne। okay, see, we are able to see only comedones over here, ऐसे लग रहा है पिंपल आई है, दैट इज कॉल्ड एज क्लोज कोमेडोन, व्हाट इज कॉल्ड एज क्लोज कोमेडोन। ओके, नाउ उसके अंदर यू आर एबल टू सी ब्लैक हेड, है ना, ये टाइप्स के देखे होंगे, दिस इज कॉल्ड एज ओपन कोमेडोन्स। इसमें से क्या होगा, एक बड़ा सा हार्ड कलर, ब्लैक कलर का या व्हाइट कलर का, फिर उसमें से हार्ड पस निकलेगा, दैट इज कॉल्ड एज क्लोज कोमेडोन। दिस वाज योर रिसेंट क्वेश्चन। ओके, कुछ पिंपल्स होते हैं, दे लुक क्लियर, क्लियर ऑन द इमेज, मतलब ऐसा लग रहा है बस पानी भरा है, राइट, पानी भरा है, दैट इज कॉल्ड एज पस्यूल, सॉरी पेप्यूल। ओके, पेप्यूल, एंड देयर आर सम पिंपल्स व्हिच यू थिंक देयर आर ओनली पस इज फील्ड, पस, दिस इज कॉल्ड एज पस्यूल। अब मुझे बताओ, इससे इजी क्वेश्चन पेपर में हो सकता है कि इमेज देख के बताना, दिस इज योर रिसेंट एमसीआई क्वेश्चन। ओके, पस निकलते ही जा रहा है, राइट, सम ऑफ अस वुड हैव हैड अ बिग पिंपल, राइट, बिग पिंपल, you took out some pus, but there is pus which is remaining inside, या फिर पस के गांठे बनी हुई अंदर, राइट, नोड्यूल, गांठे, पस, सिस्टिक, है ना, पस की गांठे, सिस्टिक, नोड्यूल्स, सो गांठ गांठ निकलती है, दैट इज कॉल्ड एज नोड्यूलो सिस्टिक एक्नी, अरे ऐसी दिखती है बड़ी सी, राइट. दिस इज कॉल्ड एज नोड्यूलोसिस्टिक एक्ने. पढ़ा है हमने, लेकिन वो देखा है लेकिन समझ नहीं पा रहे क्या है ना. फॉरेनर, a foreigner, a foreigner with redness on the face, a foreigner with redness on the face. आंख लगा के मारना है, एक्ने रोजेशिया. ठीक है. फॉरेनर विद द रेडनेस ऑन द फेस, एक्ने रोजेशिया. Fox Fordyce disease and Fox Fordyce spot is different. Name do sound similar. Name do sound similar. Remember, Fox Fordyce disease लिखा है. The answer is apocrine gland. Okay. And Fox Fordyce spot means ectopic sebaceous gland. Okay. Ectopic sebaceous gland. ये easy question भी पूछे जा चुके हैं. And it will be present most commonly in the upper lip. It will be present most commonly in the upper lip. ठीक है. We will finish this session because आपका time important है. Okay. There are some one liners which is written in detail in the PDF. Do read it at least once. I have given you hint how to understand. ठीक है. धर्म बहुत है पढ़ने के लिए, लेकिन